Hi, my name is Laurel, and today I'm going to demonstrate how to use the Gonal-F Pen. The Gonal-F Pen is a really cool little pen here. It's super easy to use. All you have to do is dial your dose that the clinic has told you to take, and if you go too far, you can just dial it back. You can go back and forth. It's not going to hurt the pen. So just find your dose. A typical dose is 300 units, so that's what I'm going to demonstrate today. Not sure if you can see that very well, but there's 300 units. You take your needle, pull off the tab. There's a needle on this side, which goes in to access the medication. You twist it all the way on, and then you pull off the outer two caps. You find a spot in your tummy, anywhere in your tummy, as long as it's at least an inch away from the belly button. And you don't want to inject into a spot that already has a little bruise or any soreness or redness from a previous shot. You're going to find a spot in the belly that has some fatty tissue that you can squeeze. You're going to squeeze the belly, go straight in like a dart, let go of this squeeze, and inject the medication. It will click, 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 click until it's already all instilled. In the little window, you will see 0, and you'll know that you're done. So you wait 3 seconds, have a Kleenex handy, pull out, and hold your skin. If after about 10 to 15 seconds, your skin is dry, then you're done. If you do notice some medicine leaking out or some bleeding, which can happen, it's not something that is a problem, but you just need to hold your skin a little longer until it's dry. The pen now has a medication still left in it, so you don't want to throw that away. You want to take your large cap, slide it on there, twist it off. This part will go in the sharps container, and then the cap goes back on the pen, and you can put it back in the refrigerator for the following injection. And that's all there is to that.